Hey Staten Island, this is HealthWish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Today, HealthWish is joined by Drs. Nicole Berwald, Pamela Feuer, and Ronit Gilad, who discuss the unique challenges women face when pursuing a career in medicine. Give a listen.
I'm excited to be here for HealthWish, Women's Healthcare on Staten Island. I'm Dr. Nicole Berwald. I'm the chair of the Department of Emergency Medicine at Staten Island University Hospital. And I'm here with two of my friends and colleagues, Dr. Pamela Feuer, the Director of Pediatric Critical Care, and Dr. Ronit Gilad, the Director of Neurosurgery. Before we get started, I'd like them both to introduce themselves. Tell us a little bit about your role at the hospital. Dr. Feuer, why don't you begin?
Thank you, Nicole. I'm really pleased to be here. I am a pediatric critical care medicine specialist at Staten Island University Hospital, otherwise known as a pediatric intensivist. And my physician role is to take care of any critically ill or injured children or complex post-operative children to provide them the best monitoring, care, and outcome. And I lead the division to make sure that our team, multidisciplinary team, works together well to provide excellent outcomes.
And Dr. Gilad?
Thank you so much for having me here today. It's really an honor to be here amongst these women in healthcare, especially a pioneer such as Dr. Feuer. I have been a neurosurgeon now since 2009. I became director of the Department of Neurosurgery. As part of my role as director, not only am I responsible for providing outstanding neurosurgical care, great outcomes at the hospital, but we're developing new programs and divisions within the Department of Neurosurgery that will expand the neurosurgical services at Staten Island University Hospital.
And as I mentioned, I'm the chair of the Department of Emergency Medicine and covering both of the emergency departments for SIUH. I'm able to be responsible for the patient care of over 300 patients a day who walk through our doors, the staff who work there, our operations, our patients' experience, our quality, et cetera. But one of the real luxuries about working in the emergency department is the opportunity to interact with all of our wonderful departments at SIUH, both of yours and the rest. Clearly, as you described, you have a very detailed role within your departments. And it must have taken some decision-making to land where you landed in neurosurgery and pediatric critical care. I'd love to learn how you ended up there with all of the different opportunity that is to offer in healthcare. Dr. Gilad.
So when I was growing up, I was kind of a bookworm, and my particular area that I gravitated towards was the neurosciences. When I went to medical school at NYU, I was really interested in doing something neuro-related, and my initial interest was neurology. In medical school, I actually did a neurosurgery rotation, and I watched a complex skull base tumor resection and the intricacy of the anatomy in that area. And from that day on, I knew this is what I was going to do. And I never looked back.
It's a big decision to make, but clearly and obviously suits you. Dr. Feuer, how'd you land where you are?
It's great to hear Dr. Gilad's story because I don't come from a family with any physicians in it, but parents who were very into education, and I too was a good learner and enjoyed the sciences and math. And then as we all grow up on medical TV shows, the TV shows around the time that I was growing up, the patients who had serious diseases like brain tumors and such, they didn't survive. And then when I was a teen, I had a friend who was diagnosed with a brain tumor, and she survived her surgery by a neurosurgeon here in New York City. And from that day forward, I actually had already been considering medicine, but I was on a path, and I actually thought I would be a neurosurgeon. So I went to the same medical school as Ronit a few years earlier. And during that time, I didn't really feel all that comfortable in the operating room. But what I loved is taking care of the very, very physiology of being with patients, especially children who are different at every stage of their lives. From there, I chose pediatrics as a field. And once I was in that specialty and training in that specialty, my first rotation in the pediatric ICU, I was done. So I knew from there and pursued my training further.
Yeah, it's interesting that the exposures we get really do impact where we land. I also went into medical school anticipating a different discipline than I landed. I thought I'd be an OBGYN because there is no happier place in a hospital than where babies are born, where people are well most of the time. But through my rotations and seeing the way patients present to the emergency department, I too found myself being sold on a discipline that I think suits me. And this is something the three of us have spoken about before. Somehow through that practice of exposure, you land where you're supposed to be. And it's a unique experience that I think all three of us had. I'm going to peel the onion back one more layer. How did you even end up in medical school? What were the things that sort of drove you to pursue a career in medicine?
I think this is the perfect opportunity to just say that Dr. Feuer is a pioneer in this field, especially for women in medicine. I mentioned that before, but listening to her talk about how she wanted to be a neurosurgeon, I don't think that the environment at that time was as conducive for us to become neurosurgeons as it was for me. So I'd like to take this opportunity to thank her hard work and dedication for making it accessible to people like us.
I think that's really, not to make this about statistics and science, but we know some of those things. And, currently and for the past several years, 50% of matriculants to U.S. medical schools are women. But women still do not dominate the workforce of medicine. People come in and out of workforces for different reasons, but we see that. And we see where there's a gender divide in different disciplines of medicine, and neurosurgery is probably one of those fields that is still more male dominant. And others, emergency medicine is 1/3 women and 2/3 men at this time. And we see these changes happening. And if it weren't for those who came before us,
yes,
then we would not have the opportunities we have. So, but it is a really powerful thing.
Thank you.
Thank you.
So how'd you end up in medical school?
What was your question?
So we know you got to medical school, you had all these observations, you were a neurologist, then a neurosurgeon, budding neurosurgeon. But how'd you land there in the first place?
So growing up, I definitely was interested in the field of medicine, really for the sake of helping the community and being part of community medicine in particular. And one way I was fortunate enough to be able to accomplish that was to go through a health profession scholarship program in the United States Navy. So I was fortunate enough for them to fund my medical school. I get my education there. Even more so, I was fortunate enough to be able to serve in the U.S. Navy as a neurosurgeon after a civilian residency for 4 years. And those were some of the best 4 years of my career, just having that experience.
Wow.
I'm going to just pause and say that Dr. Gilad's a rock star. It's a tremendous story.
Yeah.
And you should be proud. Like, what got you into deciding you were going to be a doctor?
As the only daughter, I was encouraged by my parents in education. I was good at the sciences. And when it came time to go to college, my parents gave me the opportunity to do the best I could and go the best place. I couldn't fly very far away from my New York roots, but I went to Bryn Mawr College, which is an all-women's college. But the reason I chose that college was because there was an alumni regional scholarship interview. And during that interview, I met women who had graduated from Bryn Mawr, who were probably what my age is now, but back then, I walked out of that day meeting a number of bright, motivated, professional women, and I said, I want to be like them. There were high school friends of mine whose brothers were encouraged to go to college, and the women were not, or were not given support. And I didn't have a scholarship, and I went through college and medical school and such with a lot of loans, but every penny of it was worth it at that time.
You know, it's interesting. I think the three of us have something in common where we had an inclination towards the sciences, which is not really necessary to pursue a career in medicine, though it often is a natural fit. That really any field can be a gateway to medicine, as medicine can be poetic and literal. It can have touches the humanities in so many ways, but we all sort of had that same path. I too had an inclination towards science, and then in order to figure it out, because I also did not have physicians in my family, did a lot of volunteerism, right? So I volunteered in an emergency department, though that's not what sold me ultimately. Though I do remember the first day I saw a knife sticking out of someone's upper arm as something that did intrigue me. But in pediatric units and elsewhere, and I do think some of the exposure. But the paths, though they can wind and be different, it's interesting that the three of us align in that way. You mentioned you're a native New Yorker. I think we're all from the general area, and now we're all practicing at SIUH. I've been at the hospital for 13 years. Dr. Gilad mentioned she's been here for 4 years now. And Dr. Feuer, I know that you've been with us for a couple of years. Is there anything special about practicing medicine on Staten Island?
I do feel a special connection with Staten Island because although it's an island of 500,000 or more people, it feels like a small community. And that's what I enjoy about serving this community as opposed to the rest of New York City. I feel like there's a very family-oriented atmosphere in this hospital and on this island.
And I had an experience of the first 10 years of my faculty career up in Providence, Rhode Island at Hasbro Children's Hospital. And the state of Rhode Island is probably about the size of Staten Island and the population. And this experience of providing care in a community in which there are major centers within drivable distance, but the expertise that all three of us offer wasn't necessarily available, in this community's backyard. And so that's a special thing to be able to provide that and teach families and take care of kids. But I also had an unusual connection that eventually brought me back here. During 2012, I was asked to fill in for an ICU doc that was going on vacation, and this was all arranged, and I was going to spend a week covering the ICU. It turns out that the chairman of my department and I, Dr. Roth, had crossed paths 20 years before, and the day that I was to start covering Staten Island was Hurricane Sandy surge. So I actually pretty much lived at the hospital for an entire week. I came down at 2 in the morning. I live in Manhattan before all the bridges and tunnels closed, and slept in a hospital bed and helped support the resident staff and any patients that we had to take care of during the storm. And, 6 years later, when it was the right time and the right position and stuff, Dr. Roth made me an offer I couldn't refuse, and it was very nice to come back. The nurses I worked with then are still practicing in the pediatric unit, so I knew a lot of that. The residents had moved on, but the residency program was stronger. So there was a lot to teach, a lot to learn, and a lot of people to work with.
I'm happy that you brought up Hurricane Sandy, because when I think of some of the most monumental times that I've spent working on the island, Hurricane Sandy really was one of them. But it's always funny to me, we plan for the event, and as an emergency medicine person, we gravitate towards disasters. It's a funny personality trait that we have, but we do. We know this thing is coming, and how can we prepare and be there for our community? And I too was sleeping in the hospital, and I think I was there the better part of 5 days. For me, it almost circles back to something that Ronit was saying about the community that we take care of. Though I was there for the hurricane and the aftermath of the hurricane, one of the most rewarding things that I actually went through during Hurricane Sandy was partnering with some of our community-based organizations, where I was able to go into people's homes on the island after and see how they were faring. And there were patients who were involved in our home care program, where we would go and, let's say, for example, someone with high blood pressure, and check their blood pressure in their home and see if they needed medications adjusted. So it's totally outside of emergency medicine scope of practice. But seeing how this event impacted our community and how tied the hospital is as a pillar of the community just came full circle. The reason I'm at the hospital initially and for so many years is a lot of what Ronit was saying about the community. I did 2 months of my 4-year residency at the hospital. We rotated through. We didn't have our own residency at the time. But the feeling that I had working in the institution, from the clerks to the nurses, the doctors, the transporters, everyone was really there on the mission to do the same thing, to take care of our patients. And it drew me in. And that really does keep me there. It's the biggest small town on the planet. You're right. Same size as Rhode Island. Definitely the biggest small town on the planet. Something happens on the North Shore, they know on the South Shore, between 2 degrees of separation of people. It's really an interesting thing.
So what I really feel strongly towards the community feel in the hospital, in addition to the island, is that everybody knows everybody else in the hospital. The environmental services crew is related or knows someone who's a clerk on 3C. And I love that. It's everybody cares about everybody else. And when someone is sick, there's a whole slew of people praying for that person to get better. And standing behind that person to make sure that that everything is being done in order for that patient to get better. And I love that family feeling of the hospital. I wasn't here during Sandy, but we just witnessed a horrible pandemic last year where an entire community got together to try to get through this difficult time. For us in the surgical subspecialties, the operating rooms closed and we were not able to do what we do for a living. So we thought about how we can help and contribute to the needs of the hospital, being that part of us as neurosurgeons, we do spine surgery and operate on people in the prone position. So we formed a group in the hospital that went around to the units and just proned patients, which have been shown to be effective in taking care of COVID patients. It took no time for the entire podiatry department, the orthopedics department to volunteer during the height of the pandemic.
I think that speaks to 2 things. One is it takes a village in every context of all of the things we do and see, right? And knowing that someone from our environmental or dietary or clerical work, our physicians, our nurses, physician extenders, people are involved in patients' care. It's not the 3 of us sitting here. It's not the doctors. It's the team. And we do get that luxury of having this buy-in to working as a team in our institution. I'm sure it happens in other places, but I know that we have it for sure, which is remarkable. And I'll say the other thing about proning patients. So typically, we obviously don't take care of patients lying on their bellies. It's atypical, but we saw things that could happen and people jumped right into action and together to solve a problem. And I think it does speak to the people we work with in just a wonderful way. They came down to my emergency department and started proning patients. And it's not simply for those who are having the opportunity to watch us and listen to us, it's not simply rolling someone on their belly. There's a lot that goes into it. Imagine how you feel if you were in one position all the time. So it's a really big undertaking, but people jumped into action to form a team around this new thing. So.
Be sure to tune in next time as our guests share more about their career journeys and their feelings about practicing medicine on Staten Island. HealthWish wishes to thank our very special guest host, Dr. Nicole Berwald, and her special guests, Drs. Pamela Feuer and Ronit Gilad. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.